cases as of 24 o'clock, May the 14th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. Remaining confirmed cases 91, including 11 severe cases cumulatively cured and discharged from hospitals, 78,209 cumulative deaths, 4,633 cumulatively reported confirmed cases, 82,933 remaining probable cases, 4 cumulatively traced close contacts, 338,691 close contacts that remained under medical observation, 5,211. There were 11 new asymptomatic cases, 2 imported asymptomatic infections. None of them were transferred to the confirmed cases. On the day, 104 were removed from medical observation. Asymptomatic infections that remained under medical observation numbered 619, including 35 imported asymptomatic infections from Hong Kong, Macau, and Taiwan. Cumulatively reported confirmed cases 1,536, including 1,051 in the Hong Kong SAR, 45 in the Macau SAR, 440 in the Taiwan region. Yesterday, the national domestic confirmed cases were reduced to fewer than 100, but for 3 consecutive days, there has been increase in domestic cases. We are still faced with painstaking, cumbersome efforts for domestic prevention of a resurgence. We must consolidate and refine prevention control measures to prevent revival of the cases. Now we'd like to take questions from the floor. Please ask questions around today's topic. Please identify yourself before you ask questions. Now the floor is open. The journalist from the first row, please. Thank you. With China Youth Daily, today before yesterday, Beijing announced the day of school opening. Half of the students are back on campus. It might be the longest winter vacation. Many students may not be accustomed to going back to school psychologically. How should we address psychological problems with the students? I'd like to ask Madam Chen Xiefeng to take the question. I'd like to thank you for your question. Issues related to students are usually of common concern. Now we are normalizing prevention and control measures. Localities are reopening schools. Some students are faced with strong psychological burden and even suffer from psychological problems because of different reasons, which can be divided into 3 categories. First, they find it difficult to reaccustom themselves to schooling. Second, they might be faced with the pressure of going to higher level of learning or finding jobs. And the third type of problems might be indirectly related with employment issues or schooling. It might be their underlying psychological problems, which was triggered by the sudden reopening of schools. For the first category of problems, which is a common problem, at the initial stage of the outbreak, we found it difficult to accustom to staying and learning at home. After certain period of adjustments, we are accustomed to learning at home. But now we have to reaccustom ourselves to the school life. Many schools and parents want to come back to the normal stage as quickly as possible, but we shouldn't be hasty. We cannot count on the students to get reaccustomed to the new environment very quickly. It may take time. We should be psychologically prepared. More importantly, we need behavioral changes. In particular, schools should contextualize prevention and control measures on campus. They should also announce and inform the parents and the students about the measures. Students and parents should get reaccustomed to the schedule, ensure they have a good learning habit, With close collaboration between families and schools, they should go through the transitional period as quickly as possible. Second category of issues were because of realistic issues. At the normal graduation days, we naturally had the pressure of finding jobs or going to higher institutes of learning. In response to such psychological burden, the important solution is to deal with realistic problems, look at the policies, information, act actively, find opportunities, and have initiatives. Psychological adjustment is also important for those who may have setbacks in the job seeking. It is natural that students have the sense of frustration or self-denial. They tend to give up. Such situation is normal. If parents and students have divergent opinions, it may also be troublesome on the psychological health. For situations as such, we suggest that the best way is to act. Just do it. Deal with the realistic issues, and the strongest psychological support comes from affectionate bond between parents and students. And the third situation relates to the combined pressure from existing problems with the epidemic issues. In the population, there are people who have underlying psychological or mental health problems, and coming back to schools might only be the trigger. So analysis is needed to find the ultimate reason of such psychological burden. Identifying the correct reason helps to respond timely. Finally, I want to emphasize another point. That is, students are very different one from another. In face of the same pressure, some adapt quickly, some adapt slowly, some may feel greater pressure, which may lead to physical discomfort. For situations like this, schools and parents should give close attention to their children, help them to go through the rough patch. If there are psychological counseling resources on campus, such resources should be fully tapped.
Those resources should be fully mobilized, and sometimes medical institutions should also be involved if more intervention is needed to avoid any extreme events. Let's continue our questions. The lady on the right-hand side. I'm from CNR. Psychological assistance and help does play a role, but what kind of role is it with normalization of prevention and control? What else needs to be strengthened and monitored in terms of psychological intervention? Mr. He Qinghua, you have the floor. Thank you for your question. With normalization of control and prevention, according to the overall strategies laid out by President Xi Jinping, we are focusing our efforts on the following four aspects. First, we are summing up psychological services and best practices related thereto during the first stage of work. Psychological work involves a lot of departments, agencies, and professions. During the fight against the pandemic, healthcare, education, civil society organizations, and other departments and institutions have made a lot of active exploration, resulting in best practices and sound experience. To sum up that experience, it will be very helpful to help us do a good job with psychological service during the normalization of the prevention and control. So the first step to take is to sum up the good experience, to provide guidance for the next stage. Second, we need to pay more attention to senior citizens, children, the pregnant, the disabled, and the vulnerable groups. We have taken note that the day before yesterday, on the 13th of May, Secretary General Guterres of UN made a speech on the interaction between COVID-19 pandemic and psychological health, calling on the global community to pay more attention to vulnerable groups so that those groups will be cared for. Our day-to-day life support measures should be combined with psychological help so as to increase their benefits and well-being. Third, communities should stay at the core to set up networks of psychological or even mental health services and counseling. Those services should penetrate grassroots communities with grid-like organizations and networks. Number 4, we should strengthen science education about psychological health, leveraging such technologies as 5G and the internet and other technologies, so that the general public will receive more education and become more knowledgeable on psychological health. On the left-hand side, a gentleman from the third row. Thank you. I'm from China Family News. The people of Hubei province and the city of Wuhan have made a lot of sacrifices to the fight. Now the situation has been stabilized. In supporting the people of Hubei and Wuhan walk out of the shadow of the pandemic while returning to a normal state of life, what suggestions do you have? Thank you for your question. In response to your question, throughout the society, there is a consensus that the people of Hubei and of Wuhan in particular made huge sacrifices and contribution during the fight against the pandemic. And we have given them a lot of support, such as the purchasing and procurement of made in Hubei products. And the media are providing us with a lot of emotional and moving reports about how to support Hubei and Wuhan. How should we return their mindset to a normal state? There are 3 suggestions. First, we need to further enhance the right awareness of the general public. From stage 1 to the current status quo, we can see that the reason behind our victory against the virus is a process in which rationality conquers emotional reactions. We should prevent ourselves from having any prejudice. Second, concrete actions should be taken to care for those people. In the return to normal school and employment work activities, certain control measures by schools and communities are quite stringent, sometimes too stringent. Sometimes in the implementation of those measures, certain details might hurt the feelings of people from Hubei and province and Wuhan city. Most people are willing to cooperate with those measures, but we should make sure those measures are reasonable and well communicated, carried out on the footing of friendliness and equality. In this way, we can show them our love and care. Suggestion number 1, which is a targeted one, and the different localities should take different various measures to eliminate or reduce any potential discrimination. Employment discrimination impairs social justice, depriving certain segments of the population of their opportunities of work and employment, and will also hurt the prospect of having more consumption. Hurting certain part of the population will end up with hurting everyone of the society, while discriminating against others. Those people who are doing that are discriminating themselves ultimately. And according to law and regulation, any such discriminatory practice is against the law and regulation. So concrete actions should be taken to take better care of them. Thank you. Let's continue our questions. Gentlemen from the right side on the third row. from CNS. Now we have 5,000 people under quarantine. What about the psychological health for them? What issues should we pay attention to according to epidemiological studies? How can we improve psychological studies for them? How can we make them more cooperative in a willing way and reduce any feelings of discomfort? Thank you. With the drop in number of cases, the number of people quarantined is also decreasing. But at the current stage, the mentality could be very different from the early stage of quarantine. For those people quarantined, we have 5 suggestions. First, we need to help them understand the necessity of quarantine measures, because the quarantine is performed in order to ensure their own health and the health of others. A quarantined environment would help observe and monitor any physical and psychological issues, so that I hope those people will regard the quarantine period and the routine testing as an opportunity to learn of the real state of health. Second, we should help them get familiarized with the rules and the conditions of the quarantine as soon as possible. Third, on a periodic basis by phone or the internet, they should talk to their family members and others, like their parents, to feel the support of their families and the society. Number 4, having day-to-day life, observing a good pace, such as reading and sport and exercise. Number 5, at each quarantine point, we have an internet-based psychological help materials, such as meditation, music, and relaxation. And if necessary, they can call professionals via hotlines. And there are 3 suggestions for some migrant workers and employees under those measures. Sometimes for them, there might be some feelings of resistance. Well, our workers and professionals should fully explain those rules and procedures instead of talking about them in a very blunt way. And for those who feel too cooperative, we should do our best to persuade them to cooperate, telling them doing that not only helps themselves, but also points to their civil responsibility.
Then they will develop the sense of gratification. For those who found it difficult to accept the reasoning, we can postpone it. We can ask the management and the psychological counseling team to take it over. We should also tell them that we will protect their privacy. Only relevant staff and can get their information, so that they will be very free. When we receive the problems identified by the quarantined people, we must give the feedback to the management so as to provide immediate feedback and develop trust. Thank you. Next question goes to the journalist on the 4th row on the right side. Thank you. With JKB, some people are concentrating on the negative news, and they can easily develop anxiety and depression. How should we deal with a situation like this? Director Xu Chuan is taking the question. It's natural for people to look at both positive and negative news in times of pandemic outbreak. However, selective choice or over-attention on the negative information might be a psychological disease. It is particularly prevalent among the older folk. So we must help them to improve the capacity capacity of the readers. They should select authoritative information and do not listen to the rumor mongers. They should also limit the time spent on mobile phones, no more than half an hour per day, and shift the attention to the more constructive practices, such as work, learning, or recreational activities. Third, they should foster healthy lifestyle and habits, including wearing masks, good hand hygiene, use common public chopstick, separate dish dining, and other healthy lifestyle. There were also insomnia developed from anxiety. They can learn relaxation exercises, listen to some relaxing audio tracks to alleviate the burden and pressure. If the pressure goes to so up that it puts an negative impact on their daily work and life, we suggest patients to go to seek professional psychological and medicinal counseling and intervention. Next question goes to the journalist on the fourth row on the left side with the Economic Daily. Domestic prevention and control has already shown positive trend, but there are still sporadic cases. WHO and experts say we have to coexist with COVID-19 for a long time. For ordinary people, how can we get adapted to the new normal? I'd like to ask Madam Chen Xuefeng to take the question. I'd like to thank journalist from Economic Daily for your question. The normalization of prevention and control is because of uncertainties. There are still sporadic or even cluster cases in some localities. After we have normalized the prevention control measures, we should keep a vigilant eye on the prevention of imported cases and the domestic resurgence. This is the prerequisite of our work. How should we psychologically adapt ourselves to such changes? 3 points of suggestions. First, we should accept the reality, that is, we are normalizing prevention and control measures. We have to change certain behaviors. In the guidelines on the normalization of prevention and control measures issued by the State Council, there were 20 provisions suggested in 5 aspects, including scientific wearing of masks, physical distancing, the minimization of social gathering, more ventilation, good hand hygiene, the use of a public chopstick, separate dish dining. All these require behavioral changes, and in the long term, these practices help us to improve our health. So we don't have to see it as a phasal practice. Rather, it should be embedded into our long-term practices. It might be a part of our future lifestyle and way of practices. The second suggestion is that we should continuously follow the new measures adopted by the national and local governments, because we do face a lot of uncertainties. Prevention and control measures will be adjusted accordingly as we resume work and life. We have shifted attention. Maybe we have slackened the focus on prevention and control measures. If we want to do a good job in the normalization of prevention and control, we must do it in our daily work and life. We must closely watch the prevention and control measures. Such attention can also help us to be vigilant. So that was my second suggestion. Third, if we have detected sporadic cluster cases around us, we don't have to panic. In the initial stage of the outbreak, the situation was unconventional. It was very unexpected and a quick outbreak without sufficient knowledge or sufficient supplies. However, after the previous efforts, governments at all levels and individuals have accumulated experiences and are psychologically more prepared. So even if sporadic or cluster cases hit us again, we don't have to over-panic. Panic may compromise our immune system, and it may lead to some irrational practices, which experiences have told us that it was wrong. Therefore, whenever there were such cases, we must follow the local government's requirements and psychologically make adjustments and respond scientifically. Next, the question goes to the journalist on the second row on the left side. Thank you, Madam Song. With Macau Monthly, the unexpected COVID-19 outbreak posed challenges on public health and the psychological health of the general public. For the frontline health workers, patients in rehabilitation, and the general public, how should we provide psychological services to ensure their emotional health? I'd like to ask Director Shi Chun to take the question. Thank you for your question. Just as you have rightly pointed out, the COVID-19 impacts different segments of people. We divide the population into 4 segments. The first segment are the COVID-19 patients. Second, frontline workers, including health workers, epidemiologists, community volunteers. Third, people that are related to the previous 2 segments, their family members, their friends. The fourth segment of population are the general public. How should we help them to make psychological adjustment? We have some general principle. We should have differentiated measures. The general principle is normalization of measures. In a relatively long period of time, we may have to coexist with the virus. We have to accept the reality and accept the normal mental, emotional fluctuations. And the prerequisite of prevention and control must resume social activities. Second, with various measures, we can make an adjustment ourselves to guard off the psychological impact.
Such as writing diaries for memory. There are some professional measures to be taken, such as the safety lock technology. With the authoritative agencies and their public social media accounts, it has accumulated a lot of materials and experiences, such as those from Chinese Academy of Sciences. And for the past several months, we can confer a new meaning on this experience, like a new interpretation of life, how to lead a better life, how to lead our lives with better habits and nutrition, how should we love the others, especially our family members, more. Number 4, it is particularly important that we need to learn to seek help. We need to send out messages of seeking help when necessary, soliciting help from our family members, friends, and some official headlines and professional agencies. Patients are the key population that we serve. On the one hand, we need to cure their diseases with periodic health checks. Second, we need to restore their confidence in their health. Confident people have better immunity to diseases. We should restore their social functions like normal life and work as soon as possible. Lastly, we need to be reminded that most patients are recovering well. Do not exclude them, or they should not have a sense of being excluded because of their disease. Others are not afraid of them, but are afraid of their disease. For the frontline healthcare professionals, they should take adequate rest. And there should be avenues for them to vent off their emotions. For the third group, we should help reduce the worries of their family members with objective assessment and cooperation. More encouragement should be given to their family members. So actions should be taken to alleviate anxiety. For the fourth population, the general public, there should be better self-protection, unnecessary fears should be avoided, and active participation in work and studies should be promoted. The lady from the second row. CNR, we've talked about psychological changes that have happened to certain people, but for those frontline healthcare professionals, police, quarantine workers and community workers, they are still working in the frontline. How do we make sure the psychological health is upheld for them? Mr. He Qinghua, please. Thank you for your question. For the frontline healthcare, police, law and order, community, and other workers, with normalization of prevention and control, and with return to work and school and normal activities, the prevention control of the virus continues to be taken as a priority, as a top priority. Most recently, for 3 years on a row, we have small rises in the number of new cases, which means despite a normalization of control and prevention, we shall never relent in our vigilance against the virus. That requires a large number of frontline workers, such as healthcare professionals, police officers, community workers, and border control personnel, so that they can work hard to prevent further spread of the virus. There's a huge burden of work on their shoulders. They are under a lot of pressure. And the psychological health of those people should be paid adequate attention. Healthcare agencies, police bureaus and stations, customs and the border control agencies should continue to follow psychological service guidelines, so as to provide better services for the frontline workers with adequate care and psychological counseling and services if necessary, so that we can follow up the requirements of President Xi Jinping to deliver our care and love to each and every one of them. And the local party committees, local governments, and the relevant departments and agencies, and the employers, and the families, and those individuals should fully assume their respective responsibilities on psychological health, and a three-pronged effort should be pursued. Number one, on the part of the employers, those employers should observe the overall requirements of the country to pay more attention to those frontline practitioners. Based on the changes in the number of cases, the work schedules should be made more reasonable for the frontline practitioners, so that their difficulties will be better addressed with better psychological services, or sometimes psychological evaluation if necessary. In case of any issues, services should be provided to help them out. Second, on the part of the families, the family members should understand their work. There should be more communication. If there are any symptoms of bad emotions, there should be persuasion or care by the family members. If necessary, professional help should be sought. Third, those frontline practitioners themselves should always pay attention to their psychological state of health. During On the margins of busy work, they should learn to relax themselves while talking to their family members and others. In a nutshell, all interested parties should live up to their responsibilities to pay attention to and take care of frontline practitioners so that all those responsibilities and accountabilities are well implemented with our joint effort. I'm confident the psychological and physical health of the frontline practitioners will be well maintained. I think those speakers have addressed questions covering 8 aspects. Due to time, in the interest of time, that wraps up the press conference. Tomorrow we're going to talk about healthcare professionals working in Hubei province, coming from other provinces, and we will ask the relevant officials and experts to answer your questions at that session. And you're welcome and encouraged to send your questions ahead of the press briefing so that we can be better prepared to answer those questions. That's the end of today's press conference. Thank you for coming.